Do you ever just hit a gift completely out of the park and get really proud of yourself? Well, this happened to me recently because I got my friend this gorgeous 100% Mongolian cashmere sweater from Quince, and she absolutely loved it. And you want to hear the cool part? These sweaters start at just $50, which is unbelievable for such high quality. Quince makes this possible by partnering directly with the top factories that also supply high-end brands. This means they cut out the middleman, making luxury affordable for all of us. Plus, they only work with factories that prioritize safe, ethical, and responsible manufacturing. It's really great knowing that the gifts we give are created with care for both the people who make them and the planet. But back to this sweater. My friend said it was one of the softest she's ever worn, and she loved that it's stylish, yet also super cozy. It really is the kind of gift that makes someone feel special. So if you're looking for a gift that brings a little luxury into someone's life without the hefty price tag, you really can't go wrong with Quince. It's my go-to for gifts that are both thoughtful and, let's face it, pretty darn impressive. Give yourself the luxury you deserve with Quince. Go to quince.com/nurspo for free shipping on your order and 365-day returns. That's QUINCE.com/nursemo to get free shipping and 365-day returns. Quince.com/nursemo. Well, hello there. I'm Nurse Mo, and this is the Straight A Nursing Podcast where I teach concepts and share tips on how to thrive in school and at the bedside. Welcome back to another episode of Mo's Monday Minute. And in this one, we're talking about abdominal pain and when that could be an emergency. There is nothing that strikes the fear of the nursing gods in me more than a patient who says they have unexplained abdominal pain. Okay, maybe that's not true. Chest pain would scare me more, but unexplained abdominal pain is one of those things that it's really hard to figure out what's going on because think about how many organs are in the abdomen, like a bunch of them, right? And it can also be something very serious, but the symptoms are often very either very generalized and it's hard to pinpoint. So when somebody says they're having severe, significant, especially sudden onset abdominal pain, I'm going to get pretty nervous and think, oh my gosh, something really bad could be going on. The trick there is that some things that aren't really bad are also really painful, like gas. Gas pains can be really painful for your patient. But then they pass, right? So here's what I want to advise you do when your patient tells you that they have abdominal pain. So abdominal pain that is accompanied by a distended and firm abdomen could be something that is very seriously wrong. Abdominal pain that is accompanied by hypotension could be something that is very seriously wrong. I'm thinking that they're possibly bleeding internally. Abdominal pain that is accompanied by severe flank pain could also be a sign that something is very seriously wrong. Again, I'm thinking that they could be bleeding internally and they're having flank pain as it relates to that. And if the patient has abdominal pain that is accompanied with respiratory compromise, again, something very serious could be going on. When in doubt, don't ignore. Don't try to explain it away. If you find yourself trying to explain away symptoms and trying to talk yourself out of investigating further, then that's just your nurse fear being afraid of looking foolish to somebody else. It is better to escalate or ask questions when you're unsure. So go to your preceptor if you're being oriented right now. If you're a student, go to the nurse you're working with. Call your clinical instructor. Consult your charge nurse. Call an RRT if the patient's showing any signs of hemodynamic or respiratory compromise. You can always notify the MD as well. If you're nervous about notifying the MD, then use those other avenues first. Get somebody else who maybe has a little more experience to confirm that, yes, this looks serious. We need to notify the physician. But I don't want you to ever ignore those signs of serious abdominal pain. Again, that would be pain that is accompanied by a distended and firm abdomen. That's basically, you're looking at peritonitis or possibly internal bleeding there. Pain with hypotension, if the flank is very painful, or they have respiratory compromise. These are all signs that something very serious could be happening with your patient, and that would be when abdominal pain is an emergency. I hope this Mo's Monday Minute helped you, and I will see you again soon. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Have you ever wished that you had a direct line to your pediatrician to ask all the questions that constantly crop up while parenting? We sure have. That's why we launched the Bites of Health podcast. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. You can tune in while you're making your second cup of coffee or from the school drop-off line. So be sure to tune in to Bites of Health, streaming now.